COVID cases in New Jersey are on the rise, and the Garden State is bracing for those cases to reach their highest peaks in May and then again in June.
The most troubling aspect of the high case scenario isn't necessarily the peak in terms of the numbers, although those numbers are concerning, but the slow decline.
We are seeing increases primarily among younger individuals, which wasn't what we saw previously. New Jersey ranks third in hospitalizations for 100,000 in the United States, and we rank seventh in deaths.
Bergen and Essex counties have the highest numbers of confirmed cases and deaths across the state of New Jersey. Dr. Shereef Elnahal, president and CEO of University Hospital in Newark, here this morning to explain what is prompting this latest surge, why it'll get worse before it gets better. Dr. Elnahal, good to see you again.
Thanks so much for having me.
So, Doctor, let's get into this because New Jersey now one of 5 states in the country with the highest number of COVID cases, despite the expanded vaccine availability. Not something to be proud of here. The famous site in Newark has the capacity to vaccinate 6,000 people a day. You're on the front lines. What do you attribute these numbers to in this race to vaccinate versus the race against the variants? Are the variants winning?
So right now, the variants are causing the rise in cases, but there are some encouraging pieces of data that folks should be aware of. So we are seeing hospital admissions increase, but they tend to be younger people who are doing well. So discharges from the hospital are actually keeping pace with the new admissions in our hospital right here in Newark. And so I know that that's being reflected with data across the state. And it does reflect that even though the variants are causing disease that requires hospitalization, folks are able to recover more quickly because they are younger and overall healthier. So that is good news. And all the while, we're increasing the pace of vaccination significantly. Nationally, now we're well over 3 million shots a day on average. And right here in New Jersey, we're keeping up that pace as well in terms of proportionality of vaccines that the state gets. And all that's very encouraging. And you're right to say that the race for vaccination is what is going to get us out of this.
Yeah, but I want to get back to the variants, though. Are the variants covered under these vaccines? Because a lot of people worry about that.
It's a great question. And even though the variants are concerning, especially the UK variant, because it causes worse disease and it's transmitted more easily, the evidence we do have is that the vaccines actually work quite well against all the known variants. The Pfizer and Moderna vaccines have been tested, not as high of an effectiveness, but these are vaccines that have incredibly high effectiveness against the original virus and acceptable effectiveness against these variants. So the task is vaccinate as many people as possible.
Yeah, that goes in line with what we had this week. We had Dr. Fauci here Monday talking about that very issue of protection against these variants. But you just mentioned in your first answer, Dr. Elnahal, about the younger people being able to recover quicker. That brings me to this question. The sharpest rise in cases are among younger people. So is it mutating to younger folks? Or are we seeing a rise because older folks are already vaccinated because they were the first to do so? Explain the shift here.
I think that's a fantastic question because let's say we were in a scenario where we did not have these vaccines. I think we would have seen a surge by now that was similar to what we saw last April. Because if we're seeing hospitalizations in younger people, you can bet that we would have seen it in older people had they not been vaccinated. And so it's very important to distinguish that. I would say that the rise in cases in younger folks is due to some extent to relaxation, folks not taking the restrictions as seriously as before, because again, we're on our way out of this, even though we haven't crossed the finish line. But also, again, the variants are more transmissible.
I just want to be clear, when you say younger people, some people might assume that means children. Can you explain the age group of what you're actually seeing when you say younger?
Yeah, thank you for clarifying that. We're talking about people in their 40s and 50s who are being admitted to the hospital. And the case increase is really going up for people in their 20s and 30s as well. So we're not talking about children, thankfully, when I say that.
All right, so let's look at the trends, right? Let's look at where we're seeing the most cases here. We're seeing it in what Bergen County is another area where we're seeing a lot of the cases, a disparity there, and then also in Essex County. But I want to get to the actual numbers between the difference in racial lines here and who's getting the vaccine and who is not. And is that making a huge impact? Because if you look at the health commissioner, and the New Jersey State Health Commissioner saying that 56% of white New Jersey residents have been vaccinated compared to only 5.8% of black residents and only 9.5% of Hispanic residents. What is the problem here? Why aren't we seeing the numbers higher in communities of color?
Yeah, so one thing to clarify there is that those percentages are against the breakdown of total people who've been given shots. We want to make sure that that proportionality increases for Black and Hispanic people because they are represented at much higher levels in the general population. And the fact is, you can reach herd immunity in one community or another, but unless every community has that 70 to 80% of its population vaccinated, you're still going to get outbreaks. You're still going to increase the risk for everybody to get this virus, even if they are vaccinated. Because again, even though these vaccines are excellent, they're not perfect. You can possibly still get it and spread it even after you've taken the vaccine.
But
Chances are
why is
much
there
lower.
such a disparity? Is it because people are still afraid? Is it because of the historic, thoughts about vaccinations in communities of color? I mean, are we still seeing that now today?
I think it's much more an issue, Betty, of access to vaccination. We have over 60% of people in Newark who want the vaccine. So
Right.
the demand is much greater than supply. The FEMA site that was just opened here in Newark, I think is going to really help. They're vaccinating 6,000 people per day. I hope, and we're going to get data soon, that means many more Newarkers, not just folks driving in from out of town to get the vaccine, but we can expect many more people of color hopefully to get vaccinated when our supply at University Hospital and other areas in Newark increases over the next few weeks.
And it's not good news about the Johnson & Johnson vaccine either. With their mishap, it's really creating a supply issue now getting that. So you're one less in terms of getting people vaccinated, meeting the demand right now. I want to be very clear, Dr. Elnahal, with something Dr. Fauci said earlier this week about a potential for this fourth wave. You alluded to it yourself. You're talking about the latest numbers peaking sometime next week, then again in May, and then again in June. Do you see that then as labeling? I know it's tough to say a fourth wave because you don't want to frighten people, but what do you see this as?
These are projections that are based on science. So everything from the case rates in the past and how we've observed the virus to the variants themselves and how potentially resistant they can be to vaccination, the chance that maybe a variant would arise, because again, you're not going to get variants if it's not spreading. And so, if it does spread, you do increase that chance. So
Doctor,
a lot of things go into these models.
Let me ask you then, because people are planning their summer vacations, kids are back out there playing sports, right? And we're seeing some cases attributed to athletes on the field as well. What are you encouraging your patients, your families to do, knowing that 18 and younger or 16 and younger right now are not getting the vaccine?
I would advise them to wait until a little bit later in the summer to take vacations and to really start to get back to normal again. The president said, I think, a realistic goal where we can start to celebrate 4th of July and a little bit larger gatherings, especially if you're vaccinated. But we're not there yet. It's still in the beginning of April. We still haven't seen the supply increases we need to vaccinate the population to the level it needs to be. So please just hold on for another couple of months. I know we've been saying that for a long time, but now we finally have that finish line defined and we're getting to it.
All right, Dr. Elnahal, I know it's a lot to cover, but we appreciate your insight. Thank you.
Make it so clear to understand. Thank you very much.
No problem. Thank you.